Welcome to Pinktober, the month of October, the Breast Cancer Awareness Month. This is a very, very important month to us as Zimbabwe Council of Churches, the month whereby we raise awareness on breast cancer, the month when we promote early detection and treatment of breast cancer, and also the month when we also honor the survivors and those affected by breast cancer across the globe. So in this month, we are going to look on breast cancer, what is breast cancer and how it actually affects people, and whether it's treated or it's not preventable, all those things. So by definition, when we are looking at breast cancer, we're saying breast cancer is sort of a tumor, a malignant or pachona, we are saying bundu, that develops in one's breast, mostly primarily it affects the females, but also even men, it also affects men. So this is common in women, like I said, worldwide across the globe, and it accounts for over 11.7% of all new cancers cases amongst women. It has got various types. When you're looking at this medically, we are saying some non-invasive, some invasive, and this also has got some stages, various stages from stage 0 to stage 5. But it's also important that we visit some healthcare facilities so that they can guide us in terms of staging of this breast cancer. But above all, when you're looking at the last stage of it, we are saying stage 4, whereby it has actually spread within the whole body to other various organs starting from the breast. Then when I look at breast cancer as well, what are the causes of this? Sometimes it just runs within the family, might rush within the family, some family history of breast cancer, then one might also have that. Sometimes some genetic mutations whereby you're saying it's just a genetic issue within somebody's body and so forth. Then age. The older we get, about 40 years, the higher the chance that we will be of getting breast cancer. Then sometimes we're looking at also being obese, but we are more looking at the dense breast tissue. This also increases the chance of somebody having breast cancer. And then some exposure to radiation. Sometimes we've got some occupations whereby people are more exposed to radiation and so forth. So they are actually at risk of developing this breast cancer and so forth. Then how is this diagnosed? How can one tell that they've got breast cancer? Firstly, you also need to conduct what you call some self-breast examination. This is a very, very important examination whereby you assess yourself by checking your breast, the sizes, the tenderness, any growths, any engorgements, or maybe any swelling and so forth, or any notable lumps when you're palpating. So this actually tells you or makes you suspect some breast cancer. Then from there, you need to visit the healthcare facility for some further investigations. For instance, you are looking at going through some ultrasound scans, some mammography, magnetic image resonance. These are actually computerized investigations which actually now pick the actual cancerous cells. And above all, there's also a biopsy whereby a lump is connected, a breast tissue is collected for investigation. Then how is this treated? There's some surgical interventions that can be done, lumpectomy, removing that lump, or removing the entire breast, radiation therapy, chemotherapy. There are many of these. It's important that we visit some facilities for guidance. Then the prognosis of this, yes, we are saying breast cancer can kill, but there is a 5-year survival rate for breast cancer, which has improved significantly with overall survival rate of about 90% for localized breast cancer infection. In terms of prevention, we need to prevent breast cancer. And what should we do? We need to ensure that we exercise regularly, we eat a balanced diet, we have got some health weights. When you're looking at our body mass index, we need to be checked each and every time. We also need to limit alcohol and also should not smoke. Then above all, there's also an important component of breastfeeding. One should actually make sure that whenever having a child, we need to breastfeed that child. This also decreases the chance of acquiring breast cancer. Then early detection is very, very key when you're talking breast cancer. So it's important that we visit some healthcare facilities for examination and also for possible advice. As we're in this month of October, let's ensure that we we spread the message, we make sure that we raise awareness across the globe so that we save life. So as Zimbabwe Council of Churches, we are appealing to everybody so that we spread this message across the globe.